Hey everyone, how are you? Welcome to another question and answer session for MRCS exam. This is the question: what is the most useful test to clinically distinguish between an upper and lower motor neuron lesion of the face? So we have to find out, or we have to distinguish between the upper and lower motor neuron lesion in the face. Here the options are blow six out, loss of chin reflex, closed eye, raised eyebrow, and open mouth against resistance. So first of all, let's see the upper and lower motor neuron. So the upper motor neuron, which means the nucleus of the facial nerve. Here we can see the facial nerve. It arises from the brain, and it has the several nucleus. So up to the nucleus, they are known as the upper motor neuron, and beyond the nucleus of the facial nerve, they will be lower motor neuron. So in case of this figure, we can see the upper motor neuron, it is extend from here up to here, from here up to here, but lower motor neuron, it extends from this nucleus up to the base. So this is in short about the upper motor neuron and lower motor neuron. So now we have to find out the lesion which is present in the upper motor neuron and lesion which is present in the lower motor neuron. So here we can see when a structure cut, first of all, let's see, this is the normal nerve supply of the face by the facial nerve. Here we can see arises from the cortex, then it gradually descends and finally reaches into the face. In case of this picture, we can see the lesion occurs in the upper motor neuron. Here we can see this is the lesion in the upper motor neuron, and in this case we can see that the supplying area, in case of both sides of the face, we can see the upper motor neuron, it supplies the whole part of one side of the face. Here we can see this is the, if we half of the face, half of the whole face is supplied by the facial nerve, and the upper part, it is the upper part of the face, it is also supplied by the facial nerve, though one-sided facial nerve is completely cut, or upper motor neuron lesion occur in one side, but there is supply present on the both side of the face, but upper half of the face. Then we can see this is lesion in the lower motor neuron. Here we can see this is the lower motor type of the neuron lesion, and in this case, when lower motor neuron type of lesion occur, then the whole side of the face is paralyzed. So here we can see this whole half of the face not getting supply from the facial nerve when the lesion occur beyond the nucleus of the facial nerve. Here this is the another nucleus, so beyond the nucleus, if any lesion occur, then whole of the face is supply hampered. There is a differentiation between the upper motor neuron lesion and lower motor neuron lesion in case of face. Here we can see the, in case of upper motor neuron lesion occur usually at the motor cortex and the facial nucleus. Then affected side, usually contralateral side affected. In this picture, we saw that the affected in the contralateral side. Here this side affected, so contralateral side is lost. Then we can see the lower muscle of the facial paralyzed, facial expression will be lost. It was shown in the picture. Then forehead innervation is paired. That means in forehead area there will be innervation present. Here we can see this is the forehead area, and in this forehead area the innervation present. Then other symptom usually not present. In case of lower motor neuron lesion, it occurs at the level of the nerve level. That means the beyond the facial nucleus. Then it is ipsilateral, that means the same side. Here we can see the lesion occur in the same side. Upper and lower muscle of the facial expression will be lost, it is true. Then forehead also affected. Then it is incomplete eye closure. Here we can see this is the this feature. Here we can see this is the lower motor neuron lesion feature, and this whole of the half of the face, here we can see whole of the half of the face is affected. But in case of lesion in the upper motor neuron lesion, they got half of the face, then also get the half of the half of upper face. So our answer is raised eyebrow. Is raised eyebrow present? Then there is no, then there is upper motor neuron lesion. But the eyebrow is also involved, then it is lower motor neuron lesion. So through this clinical picture, we can distinguish easily between the upper motor and lower motor neuron lesion of the facial nerve. If the eyebrow raises, then lesion occurs in the upper motor neuron. Then and if the eyebrow is not raised, then it is a lower motor type of neuron lesion. Thank you all.